Good morning. Buenos dias. Assalamu alaikum. Peace and blessings be upon you all. It is a great honor, an extraordinary privilege to be able to host you here at the Inner City Muslim Action Network for a gathering that we've been very, very excited about, the Trauma-Informed Centers of Care Network. Could you give it up for each and every one that made this possible? My name is Dr. Rami Nashashibi. I have the privilege and honor of serving as the founding executive director for IMAN, which is the acronym that we go by. And as you see as you walk along the street here, we're celebrating 25 years of work in the community here in Chicago Lawn, Marquette Park, Inglewood, and other communities like it across the city, as well as a chapter in Atlanta. IMAN was really birthed out of this vision that holistic health, wellness, and healing has to be and has always been, especially for those communities that have just intrinsically understood, without the PhDs, the MDs, or the schooling, that health is holistic and that mental health demands holistic approaches to housing, to primary care, to the ability to food, to have access to fresh food, to the ability to have access to safe, dignified communities. We've been fighting for that type of vision alongside so many of you in this city for over 25 years, and I'm just grateful that you're here this morning. I want to also just begin by welcoming not only all of those extraordinary heroes on the front lines that have been doing this work like us, and I know how taxing it is, how extraordinarily overwhelming it can feel, but how also exhilarating it can be to be together in a space to know that we are doing this work together, and also for the leadership of Dr. Arwady and this extraordinary administration. Thank you for this. Can we give it up for this? They say a picture is worth 1,000 words. The juxtaposition of where we were in the city from 2019 and 2023 is an extraordinary statement. And the type of statement that we know in and of itself will not heal all the wounds that we are suffering from, but is an extraordinary beginning. We're grateful for your leadership. We're grateful for your vision, that you understand that alongside these 77 centers, that broader vision of integrative holistic care is what we're all fighting for in a way that will really speak to the wounds that not only have been suffering generationally, but really speak to the ambition and vision that so many of our communities are just waiting to fulfill. So thank you for being here, and I'll give you the mic. Can we give it up for Dr. Arwady, and thank you all.
So thank you so much. And really, this is a day about all of you. Many of the folks in this room are part of our Trauma-Informed Centers of Care Network. You are the folks every single day working to heal Chicago and coming together to build care as a system, where systems otherwise would not exist. We've handed out the maps. Today we are celebrating all 77 because we now have sites in all 77 neighborhoods in Chicago. You can applaud for that. We have sites that are offering clinical mental health care that is no barrier, no requirement for insurance, no requirement or asking about immigration status, no need to be able to pay, and able to call a single number or go to a single website to find this care. We're in communities. We love partnering with folks like IMAN, but all of the partners, 25 years here, you have trust, you have built a community here, and we want to make sure as the city, we can do everything we can to support that, to network it, to help people find it, and lift up the amazing things that make our neighborhoods different and Chicago different, but all of them focused on mental health. Mental health is health. I'm going to go ahead over on the thing here. We're going to hear an introduction from Mayor Lightfoot.
Hello, everyone. Chicago Mayor Lori Lightfoot. And it's my great honor to tell you that through the hard work of so many and led by our Department of Public Health and all of our community partners, we now have no barrier mental health services in all of our 77 neighborhoods. This is a big, big accomplishment on behalf of our city. And I wish I could be there in person with you today to celebrate this significant accomplishment. But let me give you a little bit of the backstory. Since becoming mayor in 2019, I have and we have been laser focused on improving the quality and, importantly, the accessibility of mental health services throughout our entire city, but particularly in historically disinvested in areas of our city. What we heard loud and clear from our residents is that they wanted culturally competent mental health services in their neighborhoods, not having to travel great distances to get the care and support that they needed. So I've become deeply passionate about reversing the patterns of disinvestment and improving residents' access to mental health services, which were desperately needed before the pandemic, but really needed as a result of all the trauma that the pandemic exacerbated in so many people. But I also knew from working with our team, our subject matter experts, and from many of you, that this will require more than just opening a few city-run mental health clinics. We needed to think much bigger, much bolder. We needed to coordinate all of the public health mental services that were funded by the city, the county, state, and the federal government. And importantly, we needed to work together rather than going at this issue alone. So today, 4 years later, I'm thrilled that we're now up to 177 funded sites across all of our Chicago's 77 neighborhoods. That's on top of the new clinical services being offered in 80 homeless shelters. The ambitious targets that we set with CDPH and Dr. Arwady and her team in the fall of 2019 went way beyond the walls of clinics. We needed to stand up teams of mental health professionals that would be connected to the 911 system, work in our homeless shelters, and be embedded in schools, libraries, and primary care clinics. We also needed to finally start serving children and adolescents and confront the mental health stigma preventing residents from receiving the help that they deserved and needed. And at the time when we set these goals, we were delivering roughly 3,600 people and 0 children in only 11 of our 77 communities. And as of the end of 2022, we delivered to almost 74,000 people and 14,000 children and adolescents in all of our 77 communities. And we have doubled the size of our mental health staff from 50 when I started to over 100 now. All this is to say, I am deeply proud that we have, in partnership with all of you, delivered on our promises to make sure that there were no barriers, no wrong doors for people in our city who are in need. Now, by no means our work isn't over yet. We have come a long way together, and I can't wait till we continue the collaboration to make sure we are a city that serves our people in every capacity, but particularly those in need of mental health services. So if you are in need of mental health services, there's a simple way to access them. Call 211. That's call 211 or go to mentalhealth.chicago.gov. That's mentalhealth.chicago.gov. I want to thank you all for everything that you do to make our community stronger, more equitable, fairer, and more inclusive. Congratulations to Dr. Arwady and the team at CDPH, Matt Richards. You have done a phenomenal job of making sure that we're reaching people where they are and providing the services that are necessary. God bless you all.
All right. So I'm just going to take a few minutes, less than 10 minutes, to give you a little bit of data, a little bit of overview. We're not going to get into all of the details here because I want to leave most of the time to actually bring up partners, and I'll introduce them at the end. But most of this is going to be an open conversation. We will post these slides online. There are also people who are watching on the streaming. So today, of course, we are celebrating this milestone for mental health, being in all 77 community areas. But we're also talking about what comes next. Can you move to the next slide? Or give me a clicker? Perfect, even better. All right, so we've been talking already about these maps, but I love a good map, and I think that a map tells a story way better than a lot of numbers and words can. This is where we were in 2019. Those blue dots represent the 5 city-operated clinics, which we are still proud to be operating and have invested in. The other dots represent some outreach work, a little bit of psychiatry support, but we were in 11 neighborhoods. Look at this map. There are 177 dots on that map. That's all of you and us. That's the trauma-informed centers of care in 77 neighborhoods. And it doesn't even include the fact that we now have basic primary care and basic behavioral health care in 80 homeless shelters, with more to come. This is building a system. You know how broken our healthcare system is, how hard it can be for people to access and know how to get physical health care, and then it's often even harder for mental health care. So we love this map as a comparison. To underlie a little of the data that's behind it, you heard the mayor say this, but I'll put the details on it. Across these 11 communities, we served 3,641 patients in 2019. Critical work. Amazing work. Not enough in a city of almost 3 million people. 0 children were served. We didn't take care of kids in our mental health clinics. We didn't fund the care for children. The mayor said that's not going to be a thing. And 11 neighborhoods. 5 clinics. Today, 73,889 patients served by us, by you. Congrats, yes. In a no-barrier way. 13,666 children served. All 77 neighborhoods and 177 clinical sites, plus another 80 homeless shelters. This is major progress. How do we get there? Investments. Investing in the system. In 2019, we had a budget at the city of $12 million for everything related to mental health. Our clinics, our outreach, that's a lot of money. But today, $86 million last year, $89 million this year. Big investments, which we have worked to build this network. Building the network. 50 organizations are now part of the trauma-informed centers of care. CDPH is one of those organizations, but we've got 49 partners, and I want to thank you for taking a leap of faith, for saying we'll accept some city funding, we'll open up more mental health services, we'll hire child psychiatrists, we'll think about urgent walk-in mental health, we'll stand up a school-based health center that has mental health resources in it, we'll do more outreach to those who are homeless and provide clinical care, we'll think about integrating mental health care into our food distribution services. These are some of the creative ways that you all, our trauma-informed centers of care partners, have taken, because every dot on that map, of course, has many dots underneath it that are the patients at greatest need in Chicago that are now being served. It is so important that we go beyond the walls of clinics. This room knows that well. But at the same time that we've been building the trauma-informed centers of care, just in these last few years, the city has stood up CARE. That's the Crisis Assistance Response and Engagement pilot, where we are embedding CDPH crisis mental health clinicians in the 911 system. We're expanding that. A substance use version of this just stood up on the west side last week. We're going to be in 3 more parts of the city throughout this year. Best practice, doing it for the first time. We're standing up more work with CTA, outreach to people who are continuous riders on the L. We're working to make sure that people in shelters can access care. We're thinking about people who have other needs. And of course, all of you know the difference that telehealth has really brought in terms of increasing access, increasing language access in particular across Chicago. We also think about coordinating the access to care. I'm sure every one of you has a paper list in your clinic that you use of who you call when you've got patients that have needs that you can't meet. We've had such a long way to go here to have a system of actually connecting Chicagoans who need basic resources and who need health care and mental health care, which we believe to be a human right. We have a long way to go to make it easy. But just in the last few weeks, 211 went live. In case you don't know, lots of the country uses 211. You know 911 as the emergency call that you call for emergency services all over this country. You know 311 perhaps as the number that you call to get city services, your pothole, your whatever it might be. But most of the country has similarly had a 211, a single number that you can call if you need help with health and human services. Not just that the city is offering, but if you need help with anything from utility billing to finding mental health treatment to knowing where to get help with food, there is now a 24/7, 365 number. United Way has been behind this. The Department of Family and Support Services is leading on it at the city level. It's in partnership with Suburban Cook. It's brand new, but it's a needed piece of coordination we'll be growing. And then finally, if you haven't had a chance, please do check out mentalhealth.chicago.gov. The work to try to corral the data and make it accessible and a little more standardized. Those of you who are our TIC partners know that we come to you with lots of questions about your data and who are you serving and your hours and your languages. We are using that to make sure there is a resource which CDPH is handling to really understand where are no barrier mental health services near me now. So I pulled up the address where we are now. And you can see right on the blue dot there, that's Iman. And there's Iman's information with phone numbers, with hours, with languages, being very clear that you can get free care here or care on a sliding scale, that yes, they also accept insured patients. And there's some details that there's primary care, there's telehealth, there are trauma-informed centers of care. This seems basic, but we haven't had this. And the work to continue to build this is really critical. Because if I'm sitting here and I Google it and I say, okay, there's Aman, but there's 15 other sites. All of those are offering right near here trauma-informed centers of care. They're offering mental health that is barrier-free. And just to give you a quick sense of who that is, we've got Ada S. McKinley Behavioral Health. We've got a St. Casimir's Clinic. We've got Chicago Family Health Center in the Chicago Lawn. We've got Friend Health at Western, Access at Holy Cross, HSI, their Urban Behavioral Health Institute, Pilsen Wellness at Gage Park, Sinai Medical Group at South Ashland, Esperanza, a couple of Esperanzas at 63rd and Brighton Park, 2 more Access at Kedzie Family and Ashland Family, and then the Greater Lawn Mental Health Clinic. Those are the 15 that happen to be on that map. But when I looked, it's showing 160 clinics within 10 miles of where we stand. And so the idea to say, if my child needs care, I need care in this language, I need care at 8 p.m. on a Tuesday. We're still working and we're going to continue to improve the ability to search this. But this is new, and I hope you agree with me, it's critical. Yes. And I want to just say one word about number 15 on that map, which is CDPH's Greater Lawn Mental Health Center. We are very proud of the 5 clinics that we continue to operate. We think it is important to be a direct operator and a convener. And if you look at our clinic here, we've got a single phone number that you can now call that will connect you to any of the CDPH clinics. We've made major investments, even in our clinics, as I know you have over these last few years. We've turned that clinic, it's now got a beautiful mural. How do we make spaces trauma-informed and speak to community? We now have children's services here. We have evening hours at least a couple of days here. We have telehealth. We have Spanish-speaking both groups and individual care. All of that is new in the last few years. And it's just an example of what we're trying to do in our clinics, just like we're trying to support and lift up in your spaces. So looking ahead, what's new in 2023? We will continue this investment. As long as I have a say in it. Of course, this depends on the mayor and city council, but we are intending to continue this investment. We are building the trauma-informed centers of care. One just small example, CDPH is going to be standing up some extension clinics where CDPH clinicians are going to be embedded in some of our Chicago public libraries. Not necessarily a standalone clinic, but knowing that folks are coming in. You can make an appointment. Site visits have already begun. We're starting with a few sites, working on the space, and we're going to be standing up an extension clinic at O'Hare. This example of where do we still have gaps, and then where can this city fill those in? That's what's driving some of that. We're going to continue going beyond clinic walls. We're expanding care. We're looking forward later this year to opening a sobering center in Chicago for people who are intoxicated, and instead of sending them to jail or sending them to an emergency department, can we actually work to get people connected to the care that they need? We're planning to stand up a health-focused stabilization housing site where we're looking to purchase a hotel, and similar to what we did during COVID with Hotel 166, for people experiencing homelessness who have really severe unmet health needs, mental health, substance use, physical. Folks will be able to stay on site for up to 6 months while we get their health stabilized, and then work to move them into permanent supportive care. You know what a gap this is in Chicago. This is a big deal for CDPH to try to stand up, but we again said, where are the gaps? Where can we fill in? So we're going to continue moving beyond clinic walls, of course, thinking about how 988 also fits into this as that grows. And then finally, continuing to coordinate. You're going to hear more about Unspoken. This is our campaign to turn mental health into something we talk about every day. We don't want it to be unspoken anymore. And so looking back and looking ahead, you see on the left there, just 2019 to 2022. That's been the increase in investments. That's been the increase in persons served. That's been the increase in children served. Thank you. This couldn't have happened without you. Thank you for caring for all of Chicago. I have to finish with a shout out to some members of the Chicago Department of Public Health team, who I know many of you know. I'm the one who sometimes, has the privilege to stand up and talk about this work, but it is my team that is doing this every day. And so I want to thank, first and foremost, Matt Richards, our Deputy Commissioner for Behavioral Health. Matt also started in 2019, so some of these investments are not by accident, we'll just say. And then quickly, a big shout out to Alicia Warren, Kathy Calderon, Elitza Navarez, Anna Dozel, Hannah Kenny, Livia Verclan, Joy Makatange, and Alina Rahman from the CDPH team. Thank you. And with that, it is my honor to bring up our panelists. So as I call your name, come on up and take your seat. So we are welcoming today Natalie Raymond, who is the Director of Behavioral Health at Iman, one of the federally qualified centers, federally qualified health centers, and one of our trauma-informed centers of care. We're welcoming Nestor Flores, the Vice President of Behavioral Health and Clinical Services at Ada S. McKinley. So, long-standing mental health center. We're welcoming Jessica Samperio, who is at St. Anthony's Hospital. And then finally, we're welcoming Letitia Boyd Harris, who is a clinical therapist at CDPH at the Lawndale Clinic. And she's also going to be one of the clinicians as we're working on this new library extension. She's going to be part of the team doing that in Mount Greenwood. So I'm going to go ahead and take a seat, but these folks are really representing across the trauma-informed centers of care. We don't have any private for-profit providers up here, just to be very clear. We have federally qualified health centers. We have community mental health centers. We have community-based organizations. And we have city clinics. Everybody is receiving a mix of funding, often from different levels of government. Yes, everybody's getting some funding from the city as part of the network, but we know that you're getting county funding and state funding and federal funding. And the work to think about how we coordinate that and not have the patients see the funding as the barrier, have the patients see it as the care that they need is one of the goals. So I'm going to go ahead and sit down here, and we're going to kick into panel discussion. All right. So just to kick us off, I said your organizations already, but could you just remind folks, I know you're clinicians, et cetera, just take 1 to 2 minutes about your role, but also what your organization is doing, how you might have changed or grown as being part of the Trauma-Informed Centers of Care.
All right. Good afternoon, everyone. My name is Natalie Rahman. I'm a licensed marriage and family therapist. I'm the director of behavioral health at Iman. So great to see you all, and also wanted to welcome you to our space. We're super excited and proud to be part of the Trauma-Informed Centers of Care. And some of the things that we have been able to accomplish during this short period of time, it's only been, I think, about 6 months, is the staff expansion. And so we really have been able to reduce our wait list. So we had a wait list of about 9 months. And now we've reduced it to about a month, which is amazing. It allows us to be able to also have greater access for individuals, making sure that the people who we are hiring are also culturally competent therapists who look like the people who we service. Being able to also provide groups and utilizing the trauma-informed lens, so doing yoga-informed, trauma-informed yoga, which has been amazing and super helpful for the community. And really, it just increasing access to all, and really even focusing a lot on youth. And so we've also been able to double the amount of pediatrics that we've been able to service. And then lastly, also the professional development. I mean, I know there's a lot of clinicians in this room, and you all know that it is really difficult to get those funds to be able to do the work that we do in order for us to not reduce the burnout rate that often we see. And so we've been able to take those funds to deepen our trauma-informed work, and that has been also super grateful.
All right, great.
Yeah.
I want to clap to that.
Yeah, exactly.
I would agree 100%. TICC has given us space to breathe and to explore new things to do and interventions and development and expansion of services. So I'm Nestor Flores. I've worked in community mental health for 10 years. I grew up 5 blocks from here. So it's personal. I'm invested, and so happy to be here. And yeah, the work that we do is in the trenches. It's vital. It's person-centered. And without this support that we get from the city, we would be struggling. And so I could point to many similar things, like we've been able to create groups because of the grant. We've been able to do services for people who are undocumented, who don't have insurance, and just even start that psychoeducation process. Sometimes in community mental health, you're kind of on a time clock. You have to sort of do the assessment and then the treatment, and there's all these standards. But with this grant, we could take our time. So that's what I meant by breathing, and just sort of been able to really drill down to what people need.
Great.
So,
thank you.
Yeah.
Buenos dias, good morning. My name is Jessica Samperio, and I'm a licensed clinical social worker. I am from Little Village, so similar to your experience, this is very personal to me. I grew up in a neighborhood, and I often witness just the lack of social workers, therapists that looked like me. And honestly, that's the reason why I became a social worker, was because I was able to connect with a social worker at school that, really uplifted me and showed me that I can do things and improve my future. So shout out to Ms. Soto. Thank you so much. So since starting this program, I've been able to work within schools. Right now, I've been located at 3 schools, and there's more need, more people reaching out to me if they can be included as well. So the need is there. Yeah, and I'm just really grateful to be part of the network.
Great.
Good morning. I'm Letitia Harris Boyd. I am a clinical therapist at CDPH's Lawndale Mental Health Clinic. And our mission now, what we're doing a lot of is we're hiring more clinicians, right? Because we want to serve more individuals. And we're really excited about serving our youth. We've extended our hours to accommodate, their school schedules, after school activities. We're looking forward to going into these libraries, to really meet the residents where they are, those who may not want to come to the traditional clinics, but we have our extension clinics, and that's what we look at the library as, because it is a safe haven for the community.
All right, great. So, thank you. So let's kind of get into some of the nuts and bolts here. We made a decision to call this network the Trauma-Informed Centers of Care. And I've found that people don't always really understand what that means, or it can mean different things to different people. And I'm curious, you mentioned sort of trauma-informed yoga. We heard about sort of cultural competency. When you think about sort of describing to people who maybe are not in the mental health space all the time, how do you think about either trauma-informed care or cultural competency? What does that actually look like in the organizations where you're working? And do you have thoughts about how, as a network, we could help educate around what that means? Take any portion of that. If somebody wants to jump in, you can, and we'll move around.
I just had a quick thought about the name. Mm-hmm. There's two pieces to it, right? There's trauma-informed, and then there's center of care. Mm-hmm. The trauma-informed is helpful for the community of clinicians. It gives us a North Star, a compass to say, whatever we do, we have to use it with the trauma-informed lens, right? And be sensitive to that. But I think that doesn't always resonate with the community. That it's not something that we expect them to understand. So I think the center of care piece is huge. And when we rolled out our programs, we focus on that piece. Like, what does care mean to you? What does support mean to you? And so I think balancing those two things has been tricky, but I understand why that's the name. But really understanding those two components, I think, is important.
Yeah, and I think it's this challenge between we want to make sure we want to give the breathing room, we want to really make sure that's the focus, and also encompass the wide range of work. So.
Yeah, and I think to elaborate on that, one of the key pieces that I think about is safety. And oftentimes the people who we serve have been burnt in one way or another by different systems. And so being able to be intentional about providing that safety and thinking about that in even a holistic manner of when people are walking through the door, like here at Iman, we have our security team, which we call them community engagement and safety. So even the way that we label, our roles and, people they're opening the door for you. How are you? Taking a look at even when you're walking into your center and even looking at the aesthetics of it. Who is greeting you in the front door, in the front desk? Are the forms, in the language that you understand? Do you see pictures on the wall that actually depict your family or people who you know? Is even, the colors of the walls, are they calming enough? And that's just the front portion of it, not even when you're walking through the door and thinking about even the providers. And are they even, trauma informed or, know anything about yes, they've gone through schooling and maybe they've had a psych rotation, right? But we also do know that that's very different than having a mental health first aid training and being the people who can then be, referring to us. And so I think that that's also really important. When I think about that, I think of just safety and how people are feeling. And we also do know that with trauma, it's all about the body. And so thinking about how people are feeling even as they're walking through the door.
Yeah, I love that. Letitia or Jessica?
Yeah, I was going to add, thank you for talking about safety, Natalie, because that's a huge component when it comes to trauma-informed care. So as a school therapist, I think that's one of the main elements when you start out work is really having a space for all students, right, to feel safe. And what does that look like? It means spreading awareness about bullying, spreading awareness about LGBTQIA issues in schools, bringing up issues that students are talking about, right? And that's something that we, as a school system, need to be like bringing in parents, bringing in students in the conversation, so to really make it safe, to really feel like they're being heard. So thank you for bringing up safety, because that really like brought up this thought.
I also would like to add, Natalie, thanks for bringing up your, I'm sorry, something that you said triggered something. But what we're doing, we're all, of course, our team is trauma informed. But this year, we're taking a lot of strides to get certified in a lot of treatment modalities that's out here to treat trauma. Okay, whether it's EMDR, and we're also working on getting certified in cognitive processing therapy. That's our team.
Yeah, great. I think a word, in the same way that people don't always use the word trauma-informed as they're thinking about this, I think a word that people very regularly use is stigma, right? Like often when I'm in conversations with folks, there's this generic sort of, oh, people aren't getting care because of stigma. But I think underneath stigma, that encompasses a lot of reasons why people have hesitation to seek care. And so I'm interested, from CDPH's perspective, for example, where we think about sort of combating stigma, I mean, yes, it's making sure we're having conversations about mental health, but for us, one of the big ones was to say, we know that there are people who may feel uncomfortable walking into a building that is labeled as a mental health center. Mm-hmm. And one of our major goals was to say, where there is already high quality primary health care being offered, if you can get that mental health care at that same site, the same place you go to get your diabetes taken care of or your hypertension, mental health is health. Mm-hmm. That's one of the structural ways that we've been thinking about and working on to sort of try to decrease stigma. And so I'm interested, as you think about what it actually means to sort of work against stigma, what your thoughts are, things you're doing in your organization, how we maybe complicate that word a little bit, how we make our spaces more open and change that conversation. Again, big question, but interested in your thoughts. Do you want to start, Jessica?
Yeah, so I'm thinking more so about the language culturally, right? Yeah. Like when we think about mental health, very, very much in Latino populations, it's very like, there's a lack of trust, right? Like in the medical field, doctors, there's that power imbalance happening. So really that's why the TIC program is really important, because we're really integrating ourselves into the communities and being part of the communities, integrating their voices and what they think is important and matters to them. That's a cultural competency part. Mm-hmm. But then when you talk about stigma, I think about like rephrasing the question from what is wrong with you to what happened to you, right? That's when we talk about trauma. Yeah. We talk about like how that impacts students, in my case, behaviorally, socially, academically. It's more than just like a diagnosis, right? Like there's, so kind of eliminating that like pathology and going from a strengths-based perspective.
Mm-hmm. Love that. Other thoughts you want to add in?
I'm not a fan of the word stigma, or using that anymore, because I think we're past that.
Yeah.
10 years ago when I started in Brighton Park, actually, with Pilsen Wellness Center, yes, there was more work to do to get people to understand we were trying to help them. Mm-hmm. But I think we're past that. I think it's more about meeting clients where they're at. How can we support you? What is care?
Yeah.
And so the stigma really has to do with what you were saying structurally, the modalities. So being able to provide it in a medical center is great, but I wouldn't just do that. I would continue to do this work of 77 different types of modalities and shelters and hotels and mobile crisis response. So I think if we have that array of services and approaches, the stigma just will that'll disappear. Mm-hmm. People will be heard and seen. And that's what we need to do to start that relationship. Mm-hmm. So.
So two things. One is I really do think that we need to be creative and innovative in thinking about mental health and inserting ourselves in certain spaces that maybe aren't as open or aren't even really thinking about that. So like here at Iman at our ceramics studio, we have a ceramics classes, and we actually do groups. We've done like a parenting group in there. And so being creative about different ways, I think is essential. And I think as an FQHC for us, we are truly integrative. And by that I mean behavioral health is embedded in every single appointment that the person goes in. So we have screeners that they come in through, or when they come in that they complete, such as depression screeners. And what that does is it helps to activate if there is a referral that needs to be made. We also have social workers that are there on site. So if there are any crises and the physicians only have 20 minutes to meet with someone. And so being able to say, hey, Natalie, we have someone here who, is having a really difficult time, or maybe, they have a really high depression screening score. Can you come in and talk to them? And it's been wonderful to see that integration and being able to it's like an easy way in. And then, the other key part of it too is that, and I mentioned it before, is just like the professional development with physicians. That mental health first aid training is key, and not only with physicians, but with the community as a whole, so that they can be advocates as well for us. And then lastly, I would also say there has been also a push for community health workers. So we also were able to do that through this network and training them on mental health first aid training them on what are our services. So they're going out in the community and being advocates and being able to bring in those referrals have also been key for us.
Yeah, no wrong door. We're coming to you.
Yeah.
Stigma, old word.
Yeah. Access. Yeah.
And also, like Natalie was saying, we need to be creative. And I look at that as us also collaborating with one another. And that's what we're doing at 4 of our libraries here in Chicago. We're working with Mount Greenwood, Beverly. We're working with Blackstone, which is in the Kenwood community. And we're also working with Edgewater. And we're going to have a therapist there on site. We want to collaborate with the staff. Maybe the staff knows individuals who frequent there who may benefit from talking to someone, okay? Or in some situations where we may have to de-escalate a situation in the library, kind of assist them with that. Someone may just need someone to talk to. So just kind of meeting residents, community members, kind of where they are, where it's kind of like, you're not really coming into a traditional mental health clinic, but it's okay, come on and talk with the therapist.
Yeah, thanks.
And I think, already we were broadening this conversation. Stigma is an excuse word for me in some ways. I think access, I'm hearing kind of from all of you, is sort of where it's really at. And I agree, we agree at the health department with that. It's why we're not trying to sort of go it alone with standalone mental health clinics. It's like, what does this actually look like? But I think we still have a whole lot of gaps when I think about access. And I'm curious, even while I'm so proud of the progress, like amazing progress, I'm curious as we think about sort of where we're going next, like as a network, what do you think some of the gaps are that you're seeing in your sites or across the city? I have some sense of those. We certainly look at some data, but I like to fill that in with what you're actually seeing on the ground, and just take that any direction you like, but gaps, things to work on.
This might be predictable, but it's males. We're not reaching enough males, young males. Since I joined ADA, that's one of our goals is with TICC funds, we're constructing a psychotherapy, psychoeducational group for African American youth, and particularly males. And the idea there is, how do you get them to understand that this is a support, that we're not trying to change you, we're just trying to help you find the healthiest version of yourself, to channel that energy that you have in healthier ways. But I would say that that's, at least since at ADA, that's been a priority, and it's thanks to these funds that we could actually take the time to deconstruct this. What does it mean? Because ever since I joined the agency, I drive down these neighborhoods, and there's just a lot of desolation, a lot of despair. And to us, like Ada started as a settlement house 100 years ago for African-American migrants, but from the South, right? And what we're realizing is they're not fully settled yet, 100 years later. And that settlement isn't just economic or housing or all these other services, it's internal. It's this sort of generational trauma that even Latino immigrants carry as well, right? It's a common theme of immigration to Chicago and not being settled. And so a lot of our psychological work is to, what does that mean to finally settle them, to help them heal, and in particular with males. So,
I love that.
yeah.
Yeah. Other thoughts?
I think we often forget about the therapists themselves, right? Working in the community. And sometimes it's just not sustainable, right? Our work, the burnout is real, right? Like there's compassion fatigue, secondary trauma. So really providing that support to these professionals that are out there in the community, right? And making sure that it's something that's sustainable. And how can we do that, right? How can we provide that support? So yeah, those are just my thoughts. Like focusing more on like the mental health professionals and how we can promote that safety for them too.
Put your own mask on first, and how do we actually make that a real thing? Yes. Anybody else? Okay.
Yeah, so I can, so a couple of things that we've been noticing here. Well, one is lack of psychiatrists. It is a nightmare to try and get a person a psychiatric appointment. I spoke with one of our doctors just 2 days ago. We were talking about a mutual patient, and she said she made a referral, and the person cannot be seen. It's a year out.
Oh my God.
Right? So really thinking about what could we do to increase that access, or again, and trying to figure out innovative ways of maybe even working with like family care physicians, via telehealth to be able to consult with a psychiatrist to reduce those wait times. Also, we know as a result of this pandemic, there are huge social determinants of health, as we call case management needs, housing insecurity, employment insecurity. And so a person can come in through the door and we can assist them by providing them with certain skills in regards to mental health. But if you're really not looking at the larger ecosystem and figuring out ways to address those, then it's going to be very, very difficult to see progress, I would say faster, right?
Yeah.
Or as we would like to see.
Yeah, I think, it's interesting on the psychiatry front. Like, the Chicago Department of Public Health has always had psychiatrist positions posted because, you all know this. You can't fill them.
Yeah.
It's such a challenge. And I think we're trying to think about, one of the goals of this network, of course, is that as we're able to get a little more specific in terms of what's available when and where, and we're looking at wait lists, that, if you're in a setting where it's a long wait to see a psychiatrist, can we refer, can we sort of move across the network to get that medication management? How do we do that sort of in a system-based way? We've also, at least at CDPH, we have psychiatric nurse practitioners with the ability, to prescribe. We're thinking about telehealth, but you're right, that a lot of psychiatrists, and I think actually during COVID and just with all of those changes, given that so much care can now be delivered virtually, we have some challenges getting people who want to come work sort of full time.
And it's really, really difficult,
Yeah.
as Jessica was mentioning about providers and provider burnout of doctors who are wanting to treat the physiological aspects of it, but oftentimes the psychological aspect is impeding that.
Yeah.
And so that also leads them to feel just disempowered.
Absolutely. And I think this is where pipeline for everything, not just psychiatry, but like, how do we, I'm not supposed to be talking, I'm supposed to be letting you talk, but it's just making me sort of, what does that look like at all stages so that the mental health workforce looks like Chicago, is well-trained, and at all levels we're able to fill it in. Did you want to? You're good. Okay. So I know we're just about at time, and I want to make sure we leave some time just if folks have a few questions at the end, and also I want to make sure you all have a chance to talk to each other and kind of talk to our panelists. So maybe just to end, I want to say thank you for as always, the work, but also the thoughtfulness that you, and I know so many of you, are putting into where do we go next. We are not done. This is a milestone, but it is not complete. There are a lot of folks here in Chicago who still haven't accessed no barrier health services, and we've got a lot to do on the coordination front so that you're coming in, whatever door you're in, we connect you where you're needed. And I think, I'm absolutely thrilled with the progress and really committed sort of moving forward. So as we think about kind of just a lightning round, 30 seconds to a minute sort of thing, we're coming out of the COVID pandemic. That, of course, has been such a time of stress and grief and loss and disconnection for so many Chicagoans. It has also been a time that has brought more attention, I think, to the cracks in our social safety net. It's brought some more resources. Certainly at the health department, we're trying to figure out how do we maintain, right, the funding for this? How do we make it clear to everybody that, again, mental health is health, and that investing in this across the city, we happen to think that is a real thing that the city of Chicago should be doing long term. But looking ahead, can you just share sort of in 30 seconds or so, like your vision for mental health care in Chicago, years to come? For me, everybody could get it. We've got plenty of money, but also that we really do have an actual network so that people can, no matter which door they're entering, we get them connected to the care that they need.
Yeah. So I would say for me, having one building where it's a one-stop shop, where you have primary care, behavioral health, you also have alternative medicine, yoga, meditation, acupuncture, a space for people to come together to socialize and be in community, a space for people to also be able to access what is needed when we're talking about those case management needs.
Yeah.
That is huge in our community.
Yeah.
Yeah, thank you. I think collaboration, you started hinting at that. You mentioned the need for psychiatry. Maybe we have psychiatrists and you don't, or you have case managers and we don't. So just sitting at this table and collaborating with everyone is huge. We should not be working in silos.
Right.
There's enough work for everyone. The mission is huge. And so it's great that you brought us together, and we'll continue to do that. And I think government at large, at all levels, has to continue to invest in this. We have to continue to educate them that issues of safety, violence, poverty, those are all related to mental health. And the work that we do is going to help with that. And so it just makes sense to continue to invest. So
Great.
That would be the flag I'm waving there. So.
Yeah, although we've made huge strides, there's like a lack of diversity, right, in therapists. There's still a lack of Spanish-speaking therapists. There's a lack of Latino therapists, and the need for Latino, services is increasing, right?
Yep.
It's beyond. It's right now for our wait list, our Spanish speakers have to wait for long periods because we just don't have the therapists to provide the Spanish-speaking services. This is not just Latino, but this is also just all kinds of cultures, different nationalities, and we just don't have that diversity of therapists.
Throughout my career, I've had the opportunity to just kind of work with forensic social work. So I've learned to give positive regard to abusers, but also those being abused. So I am aware that pain lies on both parties, right? So I envision a society that would kind of normalize life stressors, crises, and events by welcoming some unconditional, positive regard. I would like to see more people vulnerable to their psychosocial needs and courageous enough to seek professional help.
I love that. So thank you. Let's give a round of applause to our panel. Just as a reminder, mostly probably for the folks who are streaming, if you want to learn more about the Trauma-Informed Centers of Care, please go to mentalhealth.chicago.gov. You can also call 211, brand new here in Chicago, if you need help getting connected to mental health care. And I'm going to mention on that point around psychiatry, right off the bat, the CDPH mental health clinics do have psychiatry capacity right now. So if there is somebody who is needing, who's already in care and needs some connection to those medications, you can check the website or you can call the CDPH intake number, which is 312-747-1020, and we can help, get that medication management supported for you if needed. Let's just maybe one or two questions. Yes.
For those clinical encounters that require an interpreter, the phone interpreter, to be used, how worthwhile do you think it would be to develop a specialized training for trauma-informed interpretation so that interpreters will know the proper words for trauma, depression, mental health crisis, feelings management, and also for that training to be offered to the community health workers so they know the proper terminology in those languages for those very same terms? Because we've also experienced at Upnagar an Urdu speaking client. She went on, and the interpreter, no nuance, very, very short summary of what this woman in distress had said. So there seems to be a huge need for training interpreters to better interpret in these crisis situations. And also, I think that could be extended to the community health workers so they also know how to use the proper terms.
It's a good idea. Yeah.
I think you just hit it on the nail. That's the issue I have with translation services.
Yeah.
And I think you were speaking to that need in terms of Latino population. So that's a great idea. I don't think we speak about that enough. And it is nuance. It's not person-centered if you're just mechanically translating words. And we know when you talk about cultural competence, it's not enough to know the language even. It goes beyond that. And so that's a excellent point.
All right. Love that idea. One more comment or question? Or shall we wrap it up and have a chance to talk to each other? Let's wrap it up. So thank you again. You guys are doing amazing work. I'm so proud to be funding and supporting the trauma-informed centers of care. And I hope that together we keep investing, we keep building, we keep coordinating and having these conversations. And I hope a year from now, that map has even more dots on it. Thanks again for coming.
You did good.